She's Associate Professor in Neurology and Head of the Neuromuscular Unit at the University of Torino in Italy.
Okay, thank you for the presentation. I add that I'm the co-coordinator at the Italian group for Pompe disease since 2006, together with Antonio Toscano, which you probably know him. And I've been involved in Pompe research, clinical research, since many years. So I'm very close to your association, to your work. So as Nadine said, for our research, we need data. Both clinicians and both researchers need it, and you have the data. So we have to find the best way to, should I go? Yes, these are my disclosures. The best way to collect this data. And that can be done only with a strong partnership with your association, and we as clinicians, and also with the regulatory agencies, because now we have to consider that the concept of registry has evolved over the years a lot, starting from simple data collection on electronic files that can be called a database, local database, or extended as observational studies across other centers. Now we have another concept of registry that is based on large platform. The technology has improved this and allows a large data collection, a larger sharing of this data, but they have very strict rules. The registry, the so-called registries, for data protection, into the privacy rules, also for the governance and the permission to utilize this data. That makes the registry very complex and sometimes very tough organization that not always are available for the needs that we as clinician and you as patient have. So this is just an introduction to say that the world must move on since registries for rare disease are so important, and you have seen how many new factors, new data must be collected, and this is an evolving field, and we cannot be restricted by regulations, and we have to discuss. And for this, even the regulatory agencies has opened and created a special task force to discuss the way how any registry must be planned, organized, and the single rules for the needs of the patient and the researchers. Here is when the first Pompe registry started. It started in 2004. Before any rules, so that was called an observational study, and still is registered on the site, which is clinicaltrials.gov, which collect all the official studies in the clinical field for all the disease. You can assess, you can digit and go and to see the organization, as you see, is still called a sponsored Genzyme Sanofi company that is not updated, of course, because so these are the characteristic of Pompe disease registry. This is a long-term, international, voluntary observational study that has been changed now with the new rules, sponsored and administered by Sanofi, Sanofi ex-Genzyme. It is the largest registry dedicated to Pompe disease because it's 20 years old, and includes data from over 2,500 patients across 240 centers all over the world, from 47 countries. And if it's easy, if I show you the map, there are 4 macro regions. One is Europe, Middle East, and Europe, and then Africa. One is North America. The third is Latin America, and then we have the Pacific, Far East Pacific region. So it is really a big effort to have all these countries regulated by these own laws to be uniformly distributed. As you see, the major data entries come from the European group, but also as a single state, United States and North America is the highest contributors. If I show you these slides that explains how many countries are still active, but so many countries are still not engaged, and there are quite a large group of countries which are not contributing anymore. This is the problem of evolving registries, of course. And these are the numbers. That I have to thank Jennifer Ertemann for allowing me to share with you these slides, of course. They are property of Sanofi. And as you see, the best, the highest contributors is United States with something less than 1,000 of patients. And it's probably most of you here are have been engaged in this. And we, as we in Italy, we are the second contributors, and then other countries from Europe that are more or less equally contributing. But if we consider the total population and the ratio of the entries and the registration and the global population, we can see that the most engaged to recruit patients is the Netherlands, because they have 144 patients registered in front of 17 million, something more than 70 million inhabitants. So the ratio is much higher. That can reflect a more capillary recruitment on their country. And we also in Italy, I can say we are the second one. There is still, yes, always a second, sorry for this. But this is a good point that there's still a lot to do to increase the number, but then we will talk about the quality. Here the progression over the years, as you see, there is a continuously increase of recruitment. Thanks to the activity of the company that set up specific monitors just to solicit all the centers to do this. But still, about quality, we can say, as you see, the yellow part is reflecting the low quality of some data, because in this case, here there are the IOPD green, and that are about 20%. The blue one are the LOPD, but still there is quite a high percentage of entries without any specification. This is not good quality of the entries, of course. This to give you some idea of the data. There are rules that, in this case, the definition of IOPD regards patient with symptoms onset before 12 months with cardiac involvement, and all the other patients are together in the group LOPD, including babies without cardiomyopathy, and also the patient identified by newborn screening who reached 12 months of age without reporting any symptoms. When I'm talking about strict rules, I'm talking about something that we have to consider when then we have to use this data, that maybe they are not exactly suitable to some kind of answer to your questions. So IOPD patient, as I told you, at about 20%. We have a mean prospective observation time about about 5 years for the two groups. But the differences, of course, are between the time of ERT starting from the symptom onset, yeah, and you can see the IOPD has a faster diagnosis, a faster start of ERT, and LOPD is still a late diagnosis in this. Yes, so these are some publications that you have that you have seen, you know very well already. The new organization includes the partnership with the patient, the organization of the Pompe Registry, Sanofi Pompe Registry, and also wants to be something that is improving. And what they did recently and are doing, and this is important probably you to know, that you can have access to this platform, and Sanofi has made plain language summaries, as you see here. For the orange one is the Pompe Registry that had allowed a number of downloads about the results and the summaries of the data. Patient representation are included in the board of the registry, and the patient-reported outcomes are going to be inserted. So there's much work to do. So this is just to summarize the good point, the point of strength, and what still has to done. That, of course, if I have to see the back side, and the data quality may not be so accurate. There are not uniform follow-up visits across the country in such a large number of countries with different resources and different healthcare resources. Privacy rules are something that can not help us sometimes, and it is very expensive to maintain this. So we have to collaborate to try to go over to this limitation, but using so much amount of data, and try to go over with the help of all of us, as probably Benedict will conclude at the end of this session. And I thank you for your attention. And this is the Italian board of the Pompe Registry that had a recent meeting. Thank you.